The second cause is neuropathic. Neuropathic basically refers to nerve pain or neuropathy. In a previous video, which I'll link up here, actually up here, or up here, no, it's up here. In a previous video, we talked about neuropathy and what the potential causes of that are, so I won't go into detail about that. But Parkinson's disease is very much associated with neuropathies. And neuropathic pain can be extremely painful. From anywhere from burning to pins and needles, could be in the hands and or the feet. It could be in actually other places like the entire limb, sciatic pain and things like that. So neuropathies certainly can be an aggravating source of pain because they're difficult to treat at times. So one of the things that would be important to consider with neuropathic pain is to discuss that with your movement disorder specialist or your neurologist, especially when it comes to supplements and things that can help, such as B6 and B12, when it comes to your nerve health with Parkinson's. Moving on down the list, now we have dystonia. Dystonia refers to involuntary muscle contractions. Parkinson's disease is notorious for causing this in certain individuals. And it's quite painful because if you could just imagine a muscle spasm going off somewhere random and you can't stop it. No matter how much you stretch it or how much you try to relax it or put heat on it, it's neurological. It's not going to let go just because you wanted to, but it's obviously very painful. Dystonia can happen in so many different places. I've seen it happen in people's upper body. I've seen it happen where the toes and the feet curl in. I've even seen it in the trunk where people kind of get all, twisted up because of it. That's something that we'll discuss, remedies to all these things in just a moment. But it's important to know that is something that's associated with Parkinson's that can also cause pain and can also cause deformities, like we talked about earlier with the muscles and the joints. Okay, next on the list is akathisia. Akathisia? Just kidding, it's akathisia. So akathisia or akathisia is referring to the inability to become comfortable or to get rid of a sensation, the inability to get rid of a sensation. And so that's basically like your restless leg syndrome, things like that. An icky feeling, jerky, you can't really get rid of it in the legs. That's also associated with Parkinson's, and there are various causes of restless leg syndrome. I also did a video on that you can see up here. Lastly, we have the central nervous system. So Parkinson's disease tends to affect the central nervous system. Obviously, Parkinson's lives in the central nervous system. It's a brain disorder. But there are other effects of Parkinson's disease besides simply the area in which is damaged, which is the substantia nigra pars compacta. The autonomic nervous system is directly impacted by Parkinson's disease, and there are areas of the brain, such as the thalamus, that directly correlate or directly relate to pain. And so if any of those areas are affected negatively by Parkinson's, there may be pain basically being generated by the brain itself. And that's really tough to treat. And unfortunately, that can be a reality for some people with Parkinson's disease.